Tonight's first order of business, it seems sitting down is the new smoking. Fourth leading cause of death worldwide is inactivity. New research shows that Canadians are too sedentary. We knew this, but the authors are hoping that putting real numbers in front of Canadians helps us get up off our couches, with half of us putting our health at risk by not moving around enough. The costs to our economy are in the billions of dollars. And here's some somber news. Even if you do exercise enough, sitting down too much as well, perhaps at work, reverses the benefits. News we shouldn't take sitting down. Welcome to The Exchange. This look at the economic benefits of exercise comes courtesy of the Conference Board of Canada. Here are some highlights. The research calls for 2.5 hours of moderate to strenuous exercise a week. Only 15% of Canadians already do that. And we spend about 10 hours a day sitting, often at work. Fewer of us also work outside. More of us are at computers. Even if 10% of Canadian couch potatoes increase their exercise to the recommended levels, it would pay off, literally. The Conference Board estimates that by 2040, GDP would increase by $7.5 billion. Meanwhile, healthcare spending on associated diseases would drop by $2.6 billion. The private sector has proved the obvious, that improved health saves money. A General Mills program found that $3.50 were saved for each dollar spent on employee wellness. At Bank of America, $1 on health initiatives translated into $6 in savings. So the message is clear. We need to get moving. Theriault is Vice President of Public Policy at the Conference Board of Canada and, of course, the folks behind the report. Louis, I want to start with whether you were surprised at the magnitude of the numbers. I was certainly surprised to learn inactivity is the fourth leading cause of death. It really does contribute to a lot and by way of illness. Were you shocked at the economic value of that?
Not really, because we've been doing work in the area for quite a while, and when you factor in the what we call the indirect benefit of lifestyle factors, improving on lifestyle factors, then you see that really clearly. Employers gain, and we gain in terms of reduced absenteeism, reduced short-term, long-term disability, reduced early mortality. All of that has a benefit to the economy. So we've been measuring that for a while. What's different here is that we're not talking necessarily about increasing physical activity, but reducing physical inactivity. So what do you do the rest of the time when you're not physically active is more important, the bottom line, to your health than actually the 2.5 hours a week of physical activity.
So one of the things that you've demonstrated is that more of us do spend a lot of time sitting. Obviously, if we're sitting 10 hours a day, some of that's at work, some of it is not at work. We know that we may go home and sit around and watch TV and not get out and exercise. What's the thought about how much work is done now seated, and the likelihood that that's a trend that's going to continue? As knowledge workers increase in the economy, likely more of us will be sitting for a living.
Yeah, that's a good point. And the service economy, 3/4 of our economy is a service economy, so it's definitely a trend, and it won't go away. Underneath that, if you think, and this is the context of the forecast, you take a 20-year forecast horizon, we're talking about kids today that are the future workers, and the kids today are rounder and weaker than 30 years ago. So that's an alarming trend, and the reason why we're doing a whole series on healthy active living. And physical activity is one dimension of it, but there's other factors as well that needs to be considered. And there's a call to action for many stakeholders here.
Sure, and obviously learning more about it is a big piece of the puzzle. We've compared it to smoking. Can you kind of give us a sense of, there was a time when people smoked in utter ignorance. Doctors thought it was good for their patients and prescribed it if you go back far enough. And then there was a period of time when we began to get information, but people kind of didn't really want to buy it. They didn't really believe it. And then you get to the point where everybody gets it. It's a bad thing. If you're doing it, you're doing a bad thing. Where are we on that curve when it comes to inactivity?
Well, for the first time, we can say that the generation of kids today have a chance of living a shorter life than their parents. So this is new in history. So I think the pendulum is starting to move in the right direction. Not only that, we have, if we put it in a super macro context, the fiscal level, the macro fiscal level, you have healthcare spending that makes up close to 50% of provincial spending in many provinces. So you're getting to a point where you're starting to look at alternative strategies, and the population health and disease prevention agenda is moving up the priority list. Funding-wise, we're not there yet, and in terms of being aware and strategies in the workplace, strategies in various settings, schools, a community, etc., being more targeted and pointed with what's effective and what's scalable is the next step. So we're contributing to that dialogue, and it's moving the dial in the right direction. But you're right, I think you need to kind of reach a point where there's a common understanding on the issue and the reason to act.
One of the things I think people wouldn't have been aware of that your research highlights is you may actually work out as much or more than is recommended, but if you also have a lot of sedentary time, if you also spend time at a desk or in front of a television, you kind of undermine the effect of the exercise. I bet there's a lot of people that work out and think, all right, well, I've done it. What's your message to those people?
Well, that's the more holistic message, I guess, is not only about your 2, 3, 4 hours of intense, vigorous physical activity a week that's going to keep you healthier or make sure that you live a healthy life. The stress level, sleep, nutrition, and those 23 hours left in the day where you're not physically active, according to the guidelines, are really fundamental. So just not sitting as much, walking a little more, those things are not being physically active per se, but it's removing the physical inactivity and the sedentary behavior out of your daily life. So small steps in that direction can go a long way. This is what we're illustrating in the report. And globally, the international community is really moving in that direction, knowing that physical activity guidelines don't have much traction among the population. So going where people do things more naturally and just changing at the margins or nudging them in the right direction will bear more fruit down the road.
Well, and this report doesn't deal with policy suggestions. I think that'll come from you folks later on. But just give us a preview of what are some of the things that do work to get through to people, as well as giving us the information that we're killing ourselves by sitting. What's some sort of policy changes that would get us up and moving?
Well, there's policy change. I would say that there's implications for many stakeholders. Government has one role to play in it. As I mentioned, like prevention, population health and population health spending in Canada are below 5% of total health budget. So there's clearly not a priority right now for government. It hasn't been seen like that. Healthcare has been on the delivery side traditionally, but with chronic disease management and chronic disease becoming the highest demand on the system with an aging population, it starts making sense to look at how you can manage these chronic conditions more effectively, and lifestyle has a lot to do with it. So that's one component. The other component is that aging also is seen in the workplace, and employers in a knowledge-based economy rely on these workers for remaining competitive in the marketplace. So there's a lot. The ROI you mentioned, in fact, is really tied to the productivity of workers, and it's tied to their health and their physical condition. So there's a role for employer as well in adapting the physical environment, encouraging people not to sit at lunchtime. Those are small things, but there's things that are seen in the literature as paying off. Just getting out at lunch and not sitting at your desk, standing every hour, small things like that. How you do that, though, is more subtle. Like you have to have the right nudging incentives, I guess, and it's not necessarily difficult to do, but you have to craft them. And there's all kinds of programs that have proven effective in that regard. So other things are in the community, schools. Like I'm from Quebec, like the latest reform in education was around, in fact, led to a reduction in physical activity class in school. So that doesn't send the right message. So there's things that we can do that are not necessarily that demanding, but sends the right message. And I think communicating that it's not about being physically active and going to the gym all the time that's going to really make it. It's about the small things that you do for the rest of your day, really.
All right, Louis, it's important research. We appreciate your time today.
My pleasure.
Louis Theriault is VP of Public Policy at the Conference Board of Canada.